So today I want to talk to you all about how to look after a pet having a seizure, what you should do if your pet has a seizure, when they're actually fitting, as well as afterwards, when you should consult your vet. Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live a healthier, happier life. So if that's something you're interested in, then consider subscribing and hitting that bell notification. Okay, so first up, it's incredibly stressful to watch your dog, to watch your cat have a seizure, especially if you've never seen one before. They lose consciousness, they can kind of thrash violently, they can lose control of their bowels, they can urinate everywhere, and it's a really distressing, upsetting thing to see. Seizures are actually only an emergency if they're lasting for longer than 5 minutes, or if your pet is having multiple seizures throughout the day, or they're having more than one seizure without really recovering in between. So those are emergencies. Otherwise, most seizures, they actually only last a matter of seconds, up to a minute or so. And although that will seem an awful long time when you're sitting there watching your pet, it really is not a long period of time. It's not dangerous if it's that length. And so it's not a true emergency. That gives us a bit of time to think about what we're going to do during the seizure and also afterwards. Okay, so my first main point of what to do when your pet is having a seizure is to watch out for your personal safety. So you might be thinking, well, I don't really care about myself, I just care about my pet. I just want to help my dog or my cat as best as I can. But really, there's no point in you getting bitten. If you get a really nasty bite to the hand, to the face, then you're not going to be any use to your pet. So really, personal safety is key. So avoiding the head end, so don't try and pull tongues out of mouths or anything like that. Don't try and pin your dog down. They may be very disorientated, certainly while they're fitting. Their jaws may be kind of clamping open and shut, and inadvertently you could get your finger, your hand in the way. Also, when they're coming round from a seizure, they can be very disorientated, and so can potentially even bite quite out of character. So we just need to be really mindful of our own safety so that we're then best able to help our pet cope with having a seizure. Okay, so my next point in looking after a dog with seizures, or certainly an epileptic dog especially who's had seizures in the past, is to actually look out for the signs that your dog might be about to have a seizure, or your cat might be about to have a seizure. Some pets, this can be really obvious, so they might start pacing, they might be really anxious, they might be really clingy. You might just notice that they do one particular thing in the build up to having a seizure. And this is known as the pre-ictal phase, or the before seizure phase. And if your pet shows a clear sign, then that can give you a really good clue that they're about to have a seizure, and take steps to help them cope while they're actually having that seizure. Now, in some pets, like I say, these signs can be very obvious. In others, they can actually be really subtle and so quite difficult, if not impossible, to pick up. And others don't seemingly show any signs that they're about to have a seizure. So this might not be applicable to you, but if your pet is one of those who does show signs, then that's something really great to look out for, because what that then allows you to do, it allows you to remove your pet from any dangerous situations. So you might be crossing the road, you might be down the beach, kind of going into the water, you might be doing something that really it would be best to avoid them doing while they're having a seizure. Also, you can move them into a safe area, so one where there's not lots of things that they could bump into, bash into and hurt themselves. So those are all things that you can consider if you notice the signs that your dog is about to have a seizure. Okay, so next up is what to do when your pet is actually having a seizure. So your dog or your cat, they've lost consciousness, they might have lost control of their bowels, they might start thrashing around. What should you actually do? Well, the first step, as I suggested before, is actually to move anything away from them that they might hurt themselves on. So that might be a table leg, chairs, it might be, a big rock or something like that that's next to them. So just if there's something that's nearby that they might bash into, then just move that away. The next thing to do is actually don't try and move your pet. So unless they're in real danger, so crossing the road, in the water, then actually just leaving your pet where they are is really the thing to do. So if you try and move them, then it's really difficult. You're likely to hurt yourself, you're potentially going to hurt them. Although it looks really distressing, they're not conscious, so they're not in pain, they're not in distress while they're having a seizure, and it's best just to leave them be. And then the third thing is actually just let them have that seizure. So don't try and hold them close, don't try and cuddle them, don't try and pin them down and stop them moving, because that can just make things things worse. It can cause muscle strains, it can hurt us, and like I say, your pet is not conscious, so they're not in any distress. Obviously, if your pet has had seizures before and your vet has advised you to give something like rectal diazepam or what have you, then obviously give that. But again, be very careful, going back to my first point, that we really need to watch out for hurting ourselves and getting injured ourselves. So there's no good if we get bitten. Okay, so next up is the recovery period. Now, depending on your pet and depending on how long the seizure was, this recovery can actually sometimes only take a couple of minutes, sometimes it can take several hours. So your pet might be disorientated, they might be really tired, so thrashing around like that takes a lot of energy. They're likely to get very hot, certainly if the seizure was a long one. So they might be disorientated, some can even appear blind, they might be really staggery and appear as though they're drunk when they're walking, they might even be unable to get up. But don't worry too much about this, just leave your pet nice and quiet. Don't stimulate them. If they're really looking for reassurance, then absolutely kind of reassure them, stroke them, cuddle them. But if they're just wanting to be quiet by themselves, then that's often the best thing to do, just in a kind of a dim, quiet environment, and let them recover from their seizure by themselves. So another thing we can do in the follow-up period is actually to keep a seizure diary. And this again is very important for our epileptic dogs and our epileptic cats, although it's much less common problem in cats. So we can write down what our pet was doing when the seizure started. Were there any signs that they were showing? What were they doing before that seizure? We can also write down how long that seizure lasted and the exact time and date. So that will then give us a picture of, is this a developing problem? Are they getting more frequent? Are they getting worse? It might also allow us to pinpoint some of those behaviours that they might be showing before they have a seizure, to give us just that early warning sign that we were talking about before. Okay, and so my last point is, should you consult your vet? Well, like I said at the beginning, seizures itself, as long as they're short, are not an emergency, but there are definitely things that you should consider when it comes to calling your vet and ringing for advice. I would certainly say that any pet who has not had a seizure in the past, you should definitely be contacting your vet just for advice, likely go in for a general check just to check there's nothing else going on. So if your pet's never had a seizure before, I'd definitely be getting in touch with your vet. It doesn't have to be absolutely at that minute, but that's something that you should be thinking about. Also, if your pet is otherwise unwell, so if they're showing other signs of illness, if they've been off their food for a bit, maybe vomiting, diarrhea, they just seem dull and depressed, then you should definitely be contacting your vet, because that might be a sign that the seizure is part of a bigger picture, another illness. So you should also be calling your vet, and calling your vet straight away. If the seizure is lasting for more than 5 minutes, after that point it starts to become dangerous and emergency treatment might be needed. So that should definitely be something, a time that you should be calling your vet. And again, if your pet is having seizures, even if they're only short but they're not recovering fully between those episodes, so they might be having one seizure, they might stop that fitting activity but then never really recover before they go into another seizure, and again that's something that is potentially an emergency situation, so you should be calling your vet any time of day or night, and that's where it helps to know where your emergency vet clinic is. And another reason to call your vet is if you're worried that they've eaten something. So if you know you've just put something out in the garden, if they've been into your pantry or into your garage or your garden shed, then they might have eaten something and you should definitely be calling your vet, because again, seizures can be a sign of poisoning, and sometimes that might be the only sign or the initial sign that we're seeing. So that is another reason that you should call your vet. Okay, so I hope this video helps you look after your pet while they're having a seizure, be they a dog or a cat. It's a very distressing situation, but if we can understand a little bit more about why it happens, and if we can give ourselves some steps of things that we can do, it can help us cope better, as well as helping your pet while they're having that seizure. So if you've got any questions, then please leave me a comment down below. Otherwise, until next time, I'm Dr. Alex from Our Pets Health, because they're family.